Stress urinary incontinence, SUI, is a prevalent and distressing medical condition that primarily affects women. It is characterized by the involuntary leakage of urine during activities that exert pressure on the bladder, such as coughing, sneezing, laughing, or physical exercise. SUI can significantly impact a woman's quality of life, leading to social, psychological, and physical distress. This video aims to delve into the causes, symptoms, conservative interventions, and surgical treatments available for stress urinary incontinence in women. Causes of stress urinary incontinence. SUI is often the result of weakened pelvic floor muscles and supportive tissues that can no longer provide adequate support to the bladder and urethra. Several factors contribute to the development of SUI. Pregnancy and childbirth. The physical strain of pregnancy and vaginal childbirth can lead to pelvic floor muscle damage and nerve injury, weakening the muscles responsible for bladder control. Aging. With age, the pelvic muscles and tissues naturally lose strength and elasticity, increasing the risk of SUI. Menopause. Hormonal changes during menopause can lead to thinning and weakening of the urethral and vaginal tissues, contributing to SUI. Obesity. Excess body weight can exert pressure on the pelvic organs and weaken the pelvic floor muscles. Chronic coughing. Conditions like chronic bronchitis and asthma that cause repeated bouts of coughing can strain the pelvic floor muscles and exacerbate SUI. Genetics. Some individuals may have a genetic predisposition to weaker pelvic floor muscles and ligaments. Symptoms of stress urinary incontinence. The primary symptom of SUI is the involuntary leakage of urine during activities that increase intra-abdominal pressure. Common scenarios triggering leakage include sneezing, coughing, laughing, lifting heavy objects, and exercising. Women with SUI may report frequent leakage of small amounts of urine during physical activities, the need to wear absorbent pads or liners to manage leakage, embarrassment, anxiety, and avoidance of social situations due to the fear of leakage, impact on sexual function and intimacy, skin irritation and discomfort due to constant moisture. Conservative interventions. Conservative approaches to managing SUI focus on strengthening the pelvic floor muscles and modifying lifestyle factors that exacerbate the condition. These interventions include pelvic floor exercises, Kegels. These exercises involve contracting and relaxing the pelvic floor muscles to improve muscle tone and support to the bladder. Behavioral strategies. Women can manage SUI by carefully timing fluid intake, practicing double voiding, urinating twice in a short span, and maintaining a healthy weight. Lifestyle modifications. Avoiding bladder irritants like caffeine and alcohol, and quitting smoking can alleviate SUI symptoms. Biofeedback. This technique helps individuals learn how to properly contract and relax pelvic floor muscles through visual or auditory feedback. Pessaries. These devices are inserted into the vagina to support the bladder and urethra, providing temporary relief from SUI. Surgical interventions. When conservative measures prove ineffective, surgical options may be considered. Sling procedures. Mid-urethral slings, such as the tension-free vaginal tape, TVT, and transobturator tape, TOT, provide support to the urethra and prevent leakage. These minimally invasive procedures involve placing a sling-like mesh under the urethra. These procedures are not approved in some countries. Colpor suspension. This procedure involves repositioning the bladder neck and urethra to improve continence. It is typically performed via open or laparoscopic surgery. Bulking agents. Injecting substances, such as collagen or synthetic materials, around the urethra can improve its sealing mechanism and reduce leakage. Artificial urinary sphincter. This device is implanted around the urethra to provide manual control over the urinary sphincter, allowing the individual to voluntarily close or open it. Sacral nerve stimulation. This involves implanting a device that delivers electrical impulses to the sacral nerves, which regulate bladder function. Conclusion. Stress urinary incontinence significantly affects the lives of many women, impacting their emotional well-being, social interactions, and physical comfort. Understanding the causes, recognizing the symptoms, and being aware of the available interventions are crucial steps toward effectively managing this condition. Conservative measures, such as pelvic floor exercises and lifestyle adjustments, can often yield positive results. For those who require more intensive treatment, surgical options offer hope for improved continence and an enhanced quality of life. Consulting healthcare professionals is essential to determine the most suitable approach for each individual, ensuring a comprehensive and tailored management plan for stress urinary incontinence. Thanks for watching this video.